My name is Jung, and I'm a physician here over at Neuroscience Specialty Centers. I'm a neurologist here. Let's talk a little bit about dementia and specifically Alzheimer's dementia. So one of the big questions that we often get is, what is dementia and what is Alzheimer's? Well, dementia is the overarching sort of umbrella term that we use to describe a cognitive and memory disorder that gets worse with time. There's many types of dementia, but Alzheimer's dementia is the most common type. Anywhere between 60 to 80% of all dementia is going to be Alzheimer's type dementia. Even before the memory loss symptoms start, tiny microscopic changes occur in your brain up to 20 years before you actually exhibit the memory problems associated with Alzheimer's. And these happen on a microscopic level, but you've got billions of brain cells, and these brain cells all go through changes, but there are certain things that can affect the brain cells that make them work less effectively, so that it can cause problems with your memory, with your talking, with your walking, with your emotions. So these are things that can happen over time that are not normal for growing older. The biggest thing that happens on the brain way before any kind of memory issue is these changes. You've all read about plaques and tangles. These are these conditions that occur that bind up your brain cells. So plaques are made out of beta amyloid. It's a certain protein that's not normal, and you have Alzheimer's, that's one of the main problems, is this beta amyloid formation. Tangles are created by something called tau, T-A-U, and it's a protein that binds up all the brain cells and creates these plaques and creates all this interference with the brain activity. And so right now in the US, there's any given time 7 million people who are over the age of 65 that have Alzheimer's, and by 2050, it's going to be more like double that. Almost 13 million people are going to have Alzheimer's dementia. So after age 65, the risk for developing Alzheimer's doubles every 5 years. And so this is not something to take lightly. So memory problems, it's normal as we get older that we forget a few things, but dementia and Alzheimer's is not normal for growing older. And so a lot of people don't know, well, what am I supposed to look out for? Well, there are some signs and symptoms that you should be looking at that would prompt an evaluation. Maybe start with your doctor or come see a neurologist like me to have this conversation. We all forget certain things, right? We've misplaced our keys, found them later. We went to the grocery store, 3 things on our mind to pick up, come back with 2, couldn't remember the third one. I mean, that's very common and happens to a lot of people. Not something too much to worry about. But when the memory stuff starts to interfere with your day-to-day activities, or starts to interfere with your abilities to do things independently, you're having to have other people do more for you, things that you used to be able to do on your own, that's when we start to worry. But nowadays, because of modern medicine and technology, we have ways of checking what your risk can be and to be proactive. So there's biomarkers. These are markers in your blood that check proteins that tell us what is your risk for developing Alzheimer's dementia. And here at Neuroscience Specialty Centers, we not only test for these biomarkers, but we also do a number of other things. We do cognitive testing, we measure brain function, we can do brainwave tests. We do a lot of things that can help us understand where you may be having problems with your memory and your cognition. So the earlier, the better. So the earlier diagnosis, quicker to treatment, better long-term outcome. So if you or a loved one may be having some memory or cognitive issues, please give us a call, see if we can help.